Thank you. Good afternoon. Every day for a while now, we've talked about the importance of testing, tracing, and treatment as a cornerstone and foundation for how we come out of this in a responsible way, recognizing coronavirus will be with us and will be a threat for the foreseeable future. But if we have that system in place to be able to rapidly test, trace, and treat on an ongoing basis, and if we all will adhere to the basic principles of physical distancing, face covering, hygiene, and temperature screenings, then we believe that it is possible to reopen our economy in large part and get things moving again without seeing a massive spike in cases and an overwhelming of our healthcare system. But of course, a foundational part of that is our ability to continue to see progress towards our goal. We've outlined an initial goal of 5,200 tests per day that we would like to see in our region. Yesterday, we had our single highest day of testing throughout the duration of the coronavirus pandemic with 3,998 tests. Today, we have surpassed that goal and are above 4,000 tests for the first time with 4,055. We will have days that are up and days that are down, but again, our trajectory is in the right direction, and we are doing well as a region in tackling this very difficult challenge of testing. But it's not enough to just have a number of tests. We are following the protocols and prioritization that's been outlined by Dr. Wooten in her guidance in terms of testing, but we also have to ensure access. We have to ensure equity. We have to make sure that communities that may not have the same historical access to health care have access to testing in a meaningful and sustained way. We've talked a lot about what we're doing in the south part of our county surrounding testing. You heard about a lot of that yesterday. And I want to spend just a moment talking about what we're doing in southeast San Diego. Tomorrow, the county's Live Well on Wheels mobile office will be making its third consecutive Saturday appearance at the Euclid Health Clinic on Euclid Avenue in southeast San Diego. But starting tomorrow and moving forward every Saturday, we plan to have this same testing opportunity available every Saturday for the foreseeable future in southeast San Diego at the Euclid Health Clinic. There are approximately 70 tests available on these Saturdays from 9 a.m. to 3 p.m., and they are free, but appointments must be made in advance by calling 211. So if you live in southeast San Diego and you would like to schedule an appointment for one of our Saturday drive-up testing, you can call 211 and make an appointment to get tested there. But that Saturday testing is not enough alone to meet the need of the community. And so I'm pleased to share with you that with the support of the state of California, we are putting a state walk-in testing in southeast San Diego starting Tuesday, May 19th. This is similar to the testing we've been doing at 3 locations throughout the county via the state, and so we will be moving a lane of this, a resource of this, to the Tubman Chavez Center at 415 Euclid Avenue starting on Tuesday, May 19th. This will offer approximately 132 appointments a day from 7 a.m. to 7 p.m., and you sign up for these via the same link and 800 number that we have shared with you in the past, and we can put out again, but this is a new opportunity for ongoing and sustained testing in southeast San Diego. I also want to announce last month Governor Newsom announced a disaster relief fund for our state's immigrant population. These are folks who work. Many of them are essential workers. They contribute to our economy. They pay taxes, and they work in our vital core sectors of many of our essential businesses. And so I'm excited to share with you now that the San Diego Disaster Relief Assistance for Immigrant Programs is going to launch on Monday, May 18th. Jewish Family Services, which is a tremendous asset to our community, and an organization that time and again has stepped up to provide critical roles and fill a great need. Jewish Family Services will operate the state of California Disaster Relief Assistance for Immigrant Project for San Diego and Imperial counties. This project is a one-time state-funded disaster relief for undocumented adult immigrants impacted by COVID-19. Any individual who qualifies can receive $500 in direct assistance with a maximum of $1,000 in assistance per household. Again, this will be beginning Monday, May 18th. Applicants who are eligible can seek assistance through the phone hotline for San Diego County. That number is 858-206-8281. And again, that will start on Monday. And our thanks and appreciations go to Jewish Family Services for once again stepping up to provide a great role. Let's jump into our slides here, our T3 testing, tracing, and treatment. Very happy to bring this slide up today. We are over 4,000 tests being done. We want to continue to see this step up progress. And again, just to highlight that there's a lot of challenges associated with this, whether it be personnel, supply chain issues, the variety of supplies that need to go into collecting the sample and transporting the sample, processing the sample, along with issues of scheduling and the logistics of individuals signing up. We are daily working through and breaking through all of those challenges and want to continue to see forward progress on our testing numbers. We're now over 96,000 total tests reported. Slight tick up in contact tracers, 175. This continues to increase. We think next week we'll continue to see more advancement as individuals that we've brought on board are trained and equipped and ready to deploy. 191 individuals in our public health motel rooms, 686 total to date. Next slide, you'll see today we're reporting 132 positive test results. Again, that's out of 4,055, our single highest day of testing ever for a 3% daily average. We've now brought our rolling 14-day average down to 4.4%. As we expand testing, we expect this number to continue to trend downward as we are testing a much wider sample and variety of folks. On our daily hospital census, slight uptick in ICU beds. Overall hospitalizations for COVID about where they were a week ago. So relatively flat, but certainly something to keep an eye on moving forward. But when you take the COVID hospitalizations on the next chart at 399 and put them relative to non-COVID, you see we still have a healthy gap of bed system capacity available to us in our region, and that is encouraging, and we appreciate our hospital partners for their continued help. Last one is just our cumulative totals. You see 5,523. Estimated recoveries over 3,500. Cumulative hospitalizations, a doubling rate of every 29 days. ICUs, a doubling rate of every 37 days. And then 8 additional deaths. And our thoughts go out to each of those families. With that, I will turn it over to Dr. Wilma Wooten for her Public Health Officer's report.